Hello everyone. Our today's topic is Introduction to General Surgery, and in this lecture we will be learning about the history, scope and fundamentals of general surgery. This lecture is divided into two parts. In the part 1, we will be learning about the history and evolution of general surgery and what is the role of general surgeon in our healthcare system and what are the basic principles of surgery, like aseptic technique, surgical instruments, and sterilization. In the next part, we will be learning about the preoperative, intraoperative, and postoperative phases of the surgery, and what is surgical team structure and what are their roles. And in the final, we will be learning about the common surgical conditions and their management. So, before going to the definition of general surgery, it is necessary to know what is basically general surgery. So, general surgery is one of the medical specialty that focuses on the diagnosis, operative and post-operative management of a wide range of conditions, and particularly in the abdomen, digestive tract, breast, skin, and soft tissues. So basically, general surgery is operative management of diseases of abdomen, digestive tract, breast, skin, and soft tissues. So what are the key features in the field of general surgery? Now, it is a broad scope, specialty of the medicine in which the general surgeons do elective surgeries and emergency surgeries. It has many common procedures like the general surgeon does. It does the appendectomies, hernia repairs, gallbladder removals, and trauma surgeries. Again, general surgery has now many foundation for subspecialties. Like there's the specialty of colorectal surgeries, a specialty of endocrine surgeries in which the surgeries for thyroid cancers are usually done, and also there's a subspecialty of minimally invasive surgeries in which laparoscopic surgeries are done and the surgeries for fibroadenoma are done. Now, in brief, what is general surgery? So basically, it is a medical discipline that involves performing various type of surgical procedures to treat a broad range of health problems and diseases. Now, what in which areas these health problem and diseases are basically treated in the field of general surgery? Now, these include the diseases of bile ducts, diseases of liver, pancreas, spleen, appendix, small and large intestine, rectum, and etc. So before moving forward, we must learn about the historical background of the general surgery. Now, general surgery, the development for general surgery was basically started from the ligature theory, which was given by Professor Ambrose. So he was the one who just laid foundation for the general surgery or the field of surgery. So in the pre-historic eras, during surgeries, blood loss was very common. So Professor Ambrose was the one who gave the ligature theory, in which he ligated the arteries which were leaking blood. And then Professor Williams, he was the one who gave the idea of painless surgeries. Like what he did, he used sulfuric ether on a patient with congenital vascular tumor of the leg. So basically, the sulfuric ether act as a pain-free like drug or anything. So he basically at that time gave the idea that you can perform surgeries without pain. So sulfuric ether just acted like a pain reliever. After that, this Dr. Joseph Lister, he was the one who just gave the idea of antisepsis and aseptic techniques, and that again played a very pivotal role in the development of antibiotics and reducing the infection rate. Then Conrad Röntgen was the one who discovered the X-rays, and now X-rays are very important. Like you're doing the surgeries of acute abdomen or any obstruction uh, for of the abdomen. You have uh, to be taking the X-rays of that area. Like X-rays again play a very important role in orthopedic surgeries. And in the last, William Stewart was the scientist who is basically uh, known as the uh, father of modern principles of surgery. So, what are basically ancient origins of surgery? Surgery has basically its development has three eras. The first one was prehistoric beginnings, which we call it Neolithic era, and in that this process, the process of trephination was very common. What did they do in that process? They were drilling the skull. That was practiced in Europe and Africa and Peru. They usually drilled the skull, and what was the purpose? Why they were doing? They were doing this to treat headaches, seizures, and any kind of spiritual uh, diseases that like release of evil spirits. So, how did we know about these skull drilling? The process of trephination. Many skulls with the healed bone edges were found, and they were basically drilled with the sharpened stones, animal teeth, and bones. So this was the prehistoric era in which trephination was done. And then came the Egyptian era. So in Egyptian era, this Dr. Edwin Smith Papyrus was the one who gave 48 trauma cases, and in which uh, he told or he basically mentioned about the wound suturing and the fracture management. And again, at that moment, there were some limitations, like there was no any anesthesia available. They used opium and alcohol for the pain. And again, deaths from infection were very high. So infection at that moment were very fatal. So after that, that came the era of Sashurta. He was the Indian physician, also known as the father of surgery, and he was the one who basically uh, gave the idea of plastic surgery, who gave the idea of reconstructive surgeries, and he wrote about 300 plus surgical procedures and wrote detailing about those procedures, in which he wrote about rhinoplasty, cataract removals, and also he was the one who invented tools like scalpels, forceps, and needles. So again, the period of Sashorta was the period of innovation for sterilized instruments, in which the instruments were sterilized with hot water and herbs. So in ancient origins, there were three common challenges that they were facing at that moment, and they were the limitations for performing more complex surgeries. The first challenge was pain management. Again, there was no any effective anesthetic available at that moment. Patients were either restrained or intoxicated to relieve the pain, but no any effective anesthetic or pain medication was not available at that moment. The second challenge was again infection. Uh, High mortality was occurring from the sepsis, and the third was blood loss. Blood loss again during surgery is very common, and at that moment they had no any idea of cauterization, tourniquets, and they no any kind of proper setup for the blood transfusions. So these were the three challenges they were facing in the ancient origins. Now, uh, the era of modern surgical revolution, these three challenges basically became three pillars for the modern surgery. Like to counter pain management, they developed the concept of anesthesia. So, like I told you, William Morton was the one who gave the concept of ether anesthesia. He performed pain-free surgery for the neck tumor, and it had a very greater impact. Like after the developing of anesthesia, they can perform longer and complex surgeries. Antisepsis was again a very important pillar in the modern surgery, in which Joseph Lister's carbolic acid played a very important role. uh, dramatically when Joseph Lister used carbolic acid. The infections dropped from 60 to 15%. So it was his legacy that sterilization was developed or it became a standard. After that, in the 90s, blood transfusions came into concept. The ABO blood groups and blood banks were developed in World War II. IV saline drips were introduced. Those saved million lives during surgeries. So, with the more revolution in the modern surgical era, they came technological leaps. Like today, we see cauterization, electrosurgery. It was developed in 1920s. William Bowes was the one who basically allowed bloodless cuts and cauterization in real time. So it was at that time used in tumor removals, amputations, and later in the laparoscopic surgeries. Antibiotics were the breakthrough in the field of medicine. We all know penicillin was the first antibiotic introduced or developed by the scientist or Dr. Fleming, and antibiotic like penicillin at that moment it decreased post of infection deaths. Now, it had the very great positive impact for the surgeons. Like surgeons now can operate on intestines, lungs, and the brain without guaranteed sepsis. So after that, minimally invasive surgeries came into concept. Laparoscopy was the very important event in the surgical field, in which now we all know tiny incisions are made and camera-guided tools are inserted in the abdomen or in any area you want to operate. So, what are the benefits of minimally invasive surgeries? There's less pain, patients have a faster recovery, and they have smaller scars too. So, if we come to the future of general surgery, we see now robotics doing all the surgeries. So, there's a rapid growth of robotic and image guide surgery for precision. And again, AI and imaging is AI is proving to be a very beneficial in the field of surgery and the medicine. Now, surgeons are pre-op planning with 3D models and AI diagnostics. Daily surgeries are being performed in today's world, like you are sitting in one country and performing the surgery on a patient in the other country. But again, all these uh, developments have some challenges, like they are all costly. You need proper training to do all these robotics, AI, and telesurgeries. And again, ethical concerns are there too. So now, what is the role of general surgeon in our healthcare system? Now, uh, general surgeon is basically a medical professional, and he is trained to perform a wide range of surgical procedures involving the abdomen, digestive tract, skin, soft tissues, and many more areas. Now, his scope of practice is basically he can perform emergency surgeries, he can perform elective surgeries, he can perform minimally invasive procedures, and he has all the knowledge about the preoperative, intraoperative, and postoperative care. In emergency surgeries like we see today, they can perform appendectomy or any trauma surgeries due to any RTA, road traffic accident, or any gunshot. Elective surgeries like hernia repairs, gallbladder removal, they can perform all these surgeries, and laparoscopic surgeries are being done very frequently. Now, a surgeon must be having key skills, like he should be having a precision about the surgery he's doing, or he should be having a good decision making power under any pressure. Like while he's performing any kind of surgery, if any complication happens, he must be well trained and to take any decision at that moment. He must be the one who should perform in teamwork, and he should be having a good patient communication. So, the importance of general surgeon again in a healthcare system is because of his versatility. Because a general surgeon can handle diverse cases. He can handle the trauma cases, like I told you, the gunshot cases in which internal bleeding is happening in the abdomen, or any RTA cases. And again, for the he is also the specialist for cancer surgeries. He's the one who saves life-saving. He does life-saving interventions. Like he's the one critical in emergencies, and if any patient having internal bleedings and infections, he's the one who will be doing surgeries. Uh, a general surgeon always works in a collaboration. He works with specialists like anesthesiologists, oncologists for comprehensive care, and a general surgeon has a greater community impact. He basically improves the quality of life through procedures like hernia repairs and mastectomies. And he should be having the theoretical and practical knowledge of the possible treatment options, and he should be having the assessment of the risk and benefit ratio, and he should be very much experienced beyond the learning curve. Now, what are the basic principles of surgery? If we come to this, we will be learning about the aseptic techniques, surgical instruments, and sterilization. So, proper aseptic technique is one of the most fundamental and essential principles of infection control in the clinical and surgical setting. Like we see what are aseptic techniques. Basically, these are techniques which remove or reduce or kill microorganisms from hands and objects. So they just employ the sterile instruments, and they reduce the patient risk of exposure to microorganisms which cannot be removed. Now, aseptic technique, again, they are the practices to minimize microbial contamination before or during the surgery. So what it includes, it basically includes hand hygiene, in which surgeons or assistant surgeons and all the other team, they do surgical scrubbing with the antiseptics. Sterile attires, again, very important. Gloves, masks, gowns, and drapes should be very much sterile. Sterile field is very important. Only sterilized instruments and touches should be allowed. Patient prep is again very important part of aseptic technique, in which patient's skin should be disinfected with chlorhexidines, and the surgeons must be using surgical barriers like surgical drapes and PPEs. Using safe operative technique is again the very much important part of aseptic technique. So what is importance of aseptic technique? Basically, it reduces the post-operative infections like surgical site infections, which cause high mortality in patients post-op. So aseptic technique has been very important factor in reducing the surgical site infections. Now, to do surgeries, you must be needing some surgical instruments. So these are the important surgical instruments which are very necessary. Like for cutting or dissecting any tissue, you need a scalpel and scissors. For grasping and holding any tissue or any organ, you must be having forceps. Forceps are different kind of forceps, hemostats, needle holders. Retractors are again very important to retract the tissue or any kind of fat. And there are many kind of retractors, Army, Navy, and Richardson. For clamping and occluding any artery, you need hemostatic clamps, and for suturing, you need needle drivers and sutures. So, in last, we come to the most important part of this, that is sterilization. Now, sterilization is basically a process to eliminate all microbes. So, sterilization basically removes bacteria, viruses, and most importantly, spores. Uh, in normal practice, we see spores are not removed with some kind of aseptic techniques, but sterilization is the process that removes spores from surgical instruments in operating rooms. So, what are the common methods implied for the sterilization? Cleaving is the most effective and most commonly used method uh, for sterilization. So in this method, basically instruments are just put in a very high temperature for certain pressure and for certain time. Like uh, they are given moist heat under pressure, like heat of 121 degree centigrade at the 15 psi for 15 minutes. So it is basically steam under pressure that kills all the microbes. Chemical stimulants are again used for sterilization, like ethylene oxide. It is used for heat-sensitive tools, and glutaraldehyde can be used. Peracetic acid is also used. Dry heat for oxidation of microbes, in which, Microbes are basically oxidized at the temperature of 160 to 170 for 2 to 4 hours. So these are basically put in ovens for moisture sensitive items. Radiation, again, sterilization is also taking place in our common practices, in which ionizing radiation like gamma rays and E-beams, they are used. They basically disrupt the microbial DNA and kill them. Hydrogen peroxide plasma, H2O2 vapor, is also used, and it basically generates free radicals, which again kill the organisms or microbes during the process of sterilization. So this was all about the part one, and we will be continuing this lecture in the part two. Thank you.